Hello, I am Dr. Hemang Ambani, Joint Repair Surgeon, KD Hospital. Today we are going to talk about myths and facts about knee replacement. So, what is the myth? What is the commonest myth? Commonest myth among all the people is whenever there is a knee pain, you have to go for knee replacement. So, people are whenever there is a knee pain, you should consult the doctor. Doctor will examine you. If needed, he will go for the X-ray or MRI. And if you have early osteoarthritis, treatment of that is only lifestyle modification. What is lifestyle modification? Lifestyle modification is certain habits should be changed in daily routine activity. One is no squatting, no cross-flexing sitting, no climbing upstairs, no going downstairs. Your weight should reduce, and most of the problem will be solved only by lifestyle modification. They even don't need any medication. If your problem is not solved with this lifestyle modification advices, then doctor may advise you to go for certain anti-inflammatory drugs which will decrease your inflammation and pain. They may advise you to go for physiotherapy treatment. So with that, your pain will decrease. Once your pain and inflammation will go, they will teach you certain anti-gravity muscle strengthening exercise. They will help you a lot. The muscles which are anti-gravity, they will help reducing the load over your knees and they will decrease the symptoms of osteoarthritis. If you are okay with this, then after that, you will be given some disease modifying drug like collagen peptide, chondroitin, glucosamine, and there are many other disease modifying drugs which will help reducing the osteoarthritis and preventing further damage to your joint. If you are not responding to this, then doctor will tell you to go for certain injections. There are two types of injections. One is a steroid injection, which we don't advocate because steroid will increase the arthritic process in your joint. There are chances of infection with the steroid. And second, third thing is steroid is having chondrodestructive activity. So it will further destroy your joint. And another is a lubricant injection or hyaluronidase injection. This injection will help in early osteoarthritis and in younger patients. So you should go to the doctor whenever there is a problem. All knee pains doesn't require knee replacement. Second commonest myth is delaying the surgery is better. So when knee replacement is indicated, when your daily activity is restricted because of knee pain, after all conservative treatment which I have mentioned, then you should go for some kind of the surgery. Delaying surgery, why it is not better? Because delaying surgery will keep more load over the unaffected part of the body, like unaffected knee, unaffected spine, and there may be degenerative changes in that as well. It even lowers the quality of your life, and it either precipitate or aggravate the medical condition like blood pressure, diabetes, hypertension, thyroid, everything, and even osteoporosis. So whenever your daily activity is compromised because of arthritis, after all conservative treatment, you should go for knee replacement surgery. So another myth is it can't be done in younger patients. So people are afraid that I am still young, I don't want to go for replacement. But as I have told you, rheumatoid arthritis, even degenerative arthritis can occur early in the age. Our youngest patient is 39 years. So when your daily activity compromised by arthritis of the knee, you should go for knee replacement. Otherwise, there are chances of damage in other part of the body as well. Another myth is diabetic patients should not go for knee replacement. 30% of our patients are diabetic patients. And to control diabetes, your physician will tell you to go for walking and all. And your walking is restricted because of arthritis. So in diabetic patients, you always can go for knee replacement. You need to take certain extra care. You need to see that your diabetes is under control. Second thing is there should not be any infection in your body, particularly urinary tract infection. So you should be careful about that. Another myth is both knee replacement should not be done simultaneously. Actually, it's a partial myth. So both knee replacement can be done simultaneously. The first thing is both the knees should be affected very badly. Then one should go for both the knee replacements. Considering patient's age, if the patient age is more than 70, then you should be cautiously doing bilateral knee replacement. If patient is having comorbid condition, multiple comorbid condition, because of that patient, if patient cannot tolerate bilateral knee replacement, then I think you should avoid going for the bilateral knee replacement in such patients. Otherwise, bilateral knee replacement is going to help you a lot, because in one stay, in one anesthesia, one physiotherapy, one medications, you can go for both the knees and your gait will improve 100%. And I think it is better to go for bilateral knee replacement if there is no contraindication of it. Another myth is all knee implants are same. So that is absolutely a myth. Knee implants are different. There are multiple knee implants like all poly, metal back, rotating platform knee, and different company knee implants are available in the market. So we decide which kind of the implant patient should go for according to the age of the patient, according to the bone condition, according to the activity level of the patient. We decide what to go for. Another myth is patients sometimes ask us that this knee is made up of stainless steel. So it is absolutely a myth. Knee is not made up of steel. We have knee replacement like this actually. So we have a femoral component or a thigh bone component, leg bone component, and a plastic. So femoral component is always made up of cobalt chrome and sometimes other metals or alternative surface like oxonium or gold. This is a tibial component which is made up of cobalt chrome or titanium, and plastic or poly or meniscus is made up of different kind of the plastic, starting from high molecular weight to low molecular weight. So people or the companies or the doctors are interested to increase the longevity of the knee. So accordingly, they advise the material used in the knee so that knee will last longer. Then another myth is knee replacement will last only for few years. That is absolutely a myth. If we go for basic knee replacement, then also it will last more than 18 years in 90% of the cases. 90% of the cases is last more than 18 years. And some implants are available like oxonium knee. They are lasting for say around 30 years. So another myth is complete bed rest is required after knee replacement, which is absolutely a myth. Patient can walk on the next day. Patient can go to the toilet. Patient can roam around. Patient can climb stairs on the third day, and patient will be discharged on the fourth day. So that is absolutely a myth that knee replacement bed rest is required for knee replacement. Another myth which is very common is about physiotherapy. Some group of the people say that no physiotherapy is required. That is absolutely a myth. Physiotherapy depends upon pre-existing condition of the joint and the muscle. Some patients who have very weak muscles and very bad joint, they require more physiotherapy. But we advocate painless, no-touch physiotherapy. So it is not that bad. But if you don't go for therapy and your muscles will remain weak, then your knee will not last longer. And some people say that painful prolonged physiotherapy is required. That is also a myth. You require the physiotherapy according to pre-existing condition. It may last for 10-15 days to 1.5 months. Then another myth is the patient post-operative period is very much painful. So definitely any surgery is going to pain somewhat, but we try to restrict pain by pain management treatment. We use multimodal pain management treatment like parenteral medications, local block, and sometimes needed local injection as well. Another myth which is we commonly face this question is, can I seat cross-legged or can I seat cross-legged or not? Actually, that is a commonly asked question to us. You can seat cross-legged, but we don't advocate patient to seat cross-legged on the down surface actually or on the floor, because when you sit cross-legged on the floor, then when you are getting up, there will be a lot of stress over your knees, and which will decrease the longevity of your joint. Then another myth is there are no complications after knee replacement. Anything or any surgery is having complication. Knee replacement also is having complications. Infection and embolism are commonest complications. We can avoid a complication, or we can prevent complication, or if needed, we can treat the complication by certain precautions. Another myth is knee replacement can be done in any hospital, which is absolutely a myth to my mind. knee replacement should be done in tertiary care hospital to avoid, prevent or treat the complications which I have mentioned above. In tertiary care hospital, there should be a facility of ICU, there should be a facility of multi-speciality doctors, critical care doctor, cardiologists, because all our patients are old age patients, they have multiple comorbid conditions. So we need to operate these patients in big multi-speciality hospital where all the facilities are available. Another myth is it can be done in any operation theater. It should not be done in any operation theater. There should be a class 100 operation theater with laminar airflow to prevent infection. So you need to be careful about that actually. So this was about myths and facts about knee replacement. So what is the take-home message for you? Take-home message is don't neglect your knee pain. Because most of the knee pain can be treated with conservative treatment, but when your knee pain restrict mobility and restrict your day-to-day activity, then you should go for knee replacement surgery, because with expert hand and good environment, it will give almost 100% result. Thank you very much.